1. Semaglutide reduces dementia risk in diabetes patients. A CWRU study reveals new insights. 2. Unlocking hidden health benefits of weight loss injections. 3. Weight loss drugs linked to lower risk of dementia and stroke in type 2 diabetes patients. 1. Semaglutide reduces dementia risk in diabetes patients. A CWRU study reveals new insights. Groundbreaking discovery: Wegovy and Ozempic ingredient may shield diabetes patients from dementia. Published July 15, 2025, 10:23 a.m. By Emma Thompson, Cleveland.com. Cleveland, could the wildly popular medication that millions use to manage diabetes and shed pounds also protect the brain? Exciting new research from Case Western Reserve School of Medicine indicates this might be true. A groundbreaking study reveals that semaglutide, the key ingredient in both Wegovy and Ozempic, appears to significantly reduce dementia risk in people with type 2 diabetes. But here's where it gets particularly interesting. The protective effect seems especially powerful for women and older adults. Semaglutide functions as a glucagon-like peptide receptor, GLP-1R, molecule that not only curbs appetite and helps control blood sugar levels in diabetic patients, but has demonstrated an impressive array of health benefits beyond its primary purpose, including notable reductions in cardiovascular disease, according to CWRU researchers. The comprehensive investigation, recently featured in the Journal of Alzheimer's Disease, examined electronic health records spanning 3 years from an enormous sample of nearly 1.7 million type 2 diabetes patients across the United States. The research team, spearheaded by distinguished biomedical informatics Professor Rong Xu from CWRU, employed sophisticated statistical methods designed to replicate the conditions of a randomized clinical trial. Their analysis yielded compelling evidence. Patients taking semaglutide exhibited a markedly decreased risk of developing Alzheimer's disease-related dementia compared to individuals using alternative anti-diabetic medications. For those unfamiliar with the terminology, dementia encompasses a spectrum of symptoms that impair memory, thinking, and reasoning capabilities, according to medical experts. Alzheimer's disease stands as the predominant cause of dementia among elderly populations. The implications of this research cannot be overstated, explained Professor Xu, who also serves as director of the School of Medicine Center for AI in Drug Discovery. With no cure or truly effective treatment currently available for dementia, our study provides valuable real-world evidence suggesting semaglutide could potentially prevent or delay dementia onset in high-risk populations. However, and this is the part many headlines might overlook, Professor Xu cautioned that despite these promising findings, certain limitations in the study design prevent researchers from drawing definitive conclusions. Further investigation, through rigorous randomized clinical trials, will be essential before we can confidently recommend semaglutide specifically for dementia prevention, she emphasized. This potential dual benefit of a medication already helping millions manage diabetes raises fascinating questions about the interconnections between metabolic disorders and neurological health. Could other diabetes medications offer similar protective effects? Might these findings eventually lead to new preventative approaches for dementia in non-diabetic populations? What's your take on this research? Would the potential brain protective benefits influence your view of these medications? Share your thoughts in the comments below. Related health coverage. Study: U.S. heart attack mortality rate dramatically down over past 50 years. Blood transfusions at trauma scenes. How Cleveland EMS is saving lives. How does HIPAA protect your health data? Free class offers answers. Community rallies behind fired UH doctors who lead physician union efforts. U.S. measles cases hit decades-long peak. Where does Ohio stand? If you purchase a product or register for an account through a link on our site, we may receive compensation. By using this site, you consent to our user agreement and agree that your clicks, interactions, and personal information may be collected, recorded, and/or stored by us and social media and other third-party partners in accordance with our privacy policy. 2. Unlocking hidden health benefits of weight loss injections. Discover the surprising health benefits of weight loss injections beyond just shedding pounds. Recent studies have shed light on how popular medications like Wegovy and Ozempic might offer a surprising defense against serious health conditions such as dementia and stroke. But here's where it gets controversial. The research, conducted by Taiwanese experts and involving over 60,000 participants worldwide, reveals intriguing findings. These individuals, all diagnosed with type 2 diabetes and obesity, were divided into two groups. Half were treated with GLP agonist drugs, including semaglutide and tirzepatide, while the other half used different anti-diabetic medications. After a 7-year observation period, the group on GLP agonist drugs showed a remarkable 37% lower risk of developing dementia and a 19% reduced risk of stroke. They also had a 30% lower mortality rate. Interestingly, the benefits were even more pronounced in individuals over 60, women, and those with a BMI between 30 and 40. These medications work by suppressing appetite, slowing digestion, reducing liver sugar production, and enhancing insulin release when needed. While their effectiveness in managing weight and blood sugar is well known, these new findings suggest potential neuroprotective and cerebrovascular benefits. However, it's important to note that the study doesn't conclusively prove that these drugs directly protect the brain. The reduction in dementia and stroke risk could also be attributed to better management of type 2 diabetes and obesity, both known risk factors for these conditions. Professor Tara Spires-Jones from the University of Edinburgh adds, "This is a very interesting study, adding to evidence that GLP-1 receptor agonists are associated with a lower risk of dementia in people with type 2 diabetes and obesity. Further work is needed, including randomized clinical trials, to confirm these drugs are protective and to explore their potential benefits in individuals without diabetes and obesity." And this is the part most people miss. While these findings are promising, more research is essential to fully understand the long-term effects and applicability of these drugs. So, what do you think? Are you optimistic about the potential of weight loss injections for preventing dementia and stroke? Share your thoughts in the comments below. 3. Weight loss drugs linked to lower risk of dementia and stroke in type 2 diabetes patients. Breakthrough medical discovery. Weight loss drugs could be your brain's secret weapon against cognitive decline. Imagine a weight loss medication that not only helps you shed pounds, but also potentially shields your brain from devastating neurological conditions. Groundbreaking research is turning this possibility into a promising reality. A comprehensive study published in the prestigious JAMA Network has unveiled remarkable findings that could revolutionize our understanding of weight loss medications and their unexpected neurological benefits. The research zeroes in on two powerful drugs, semaglutide and tirzepatide, commonly found in popular weight management treatments like Ozempic, Mounjaro, and Wegovy. But here's where it gets fascinating. These medications might do far more than just help you trim down. The study suggests they could significantly reduce the risk of serious neurological and cerebrovascular diseases for individuals battling type 2 diabetes and obesity. Diving deep into the data, researchers meticulously analyzed health records of 60,000 adults aged 40 and older over a 7-year period. The participants, tracked through the Trinetics US network from December 2017 to June 2024, provided a robust dataset for investigation. The most intriguing revelations. The protective effects were most pronounced among specific demographic groups. Women, individuals over 60, and patients with a body mass index between 30 and 40 showed the most significant neurological risk reduction. What exactly are these potential benefits? We are talking about a decreased likelihood of developing devastating conditions like dementia, Alzheimer's, and other cerebrovascular diseases that can include strokes and brain aneurysms. And this is the part most people miss: these aren't just minor statistical blips, but potentially life-changing medical insights. However, the researchers remain appropriately cautious. While the initial findings are incredibly promising, they emphasize the need for additional clinical trials to fully validate these groundbreaking observations. So, what does this mean for you? If you're managing type 2 diabetes or struggling with obesity, these medications might offer more than just weight management. They could be a potential shield for your cognitive health. What are your thoughts on this incredible medical breakthrough? Do you see this as a game changer in how we approach weight loss and neurological health? We'd love to hear your perspective in the comments below.